Hi, I'm Dr.Leela Mohan, PVR. I'm internal medicine consultant and physician. I have my own center called as Padithem Healthcare, that is in HSR layout, Bangalore. So diabesity is nothing but it's a diabetes and obesity. So what is obesity? We all know the overweight gain. All those things are considered as obesity. And diabetes, it is called as increased sugar levels in your body. So both by including, we call it as diabesity. So why usually it occurs? The diabetes is a metabolic disorder, and obesity is also one of the disorder. Usually it is not a disorder, but we will consider it as a problem only. So when we combine both, we'll call it as diabesity. But both the things are very much related. If some person, if they're having the diabetes, they can easily develop obesity, or if someone is obese, they can easily develop diabetes. They both are interrelated. So we definitely have to follow certain things to avoid the diabesity. What causes this diabesity? One on the most thing is insulin resistance. So what is this insulin and what is this resistance basically? Insulin is mainly produced by beta cells in your pancreas. So what are pancreas? Pancreas is an organ which is present in your abdomen, which mainly helps in producing the insulin. Insulin is nothing but whatever you eat food, the carbohydrates, whatever, it will get digested into glucose. The glucose will be digested or absorbed or metabolized by insulin. So when this insulin will be deficient due to certain reasons, that is called as insulin deficiency. And diabetes usually caused by insulin resistance, one of the reason. Obesity also causes the insulin resistance due to the excess accumulation of fat. It doesn't allow the insulin to work properly in the body to act on your glucose to metabolize. Adipose tissue dysfunction. So what is this adipose tissue dysfunction? Adipose tissue is nothing but your fat tissues which mainly causes dysfunction, and then also causes the insulin resistance leading to type 2 diabetes, and also increases in the formation of the obesity. So pancreatic strain. So what is this pancreatic strain? Due to the excess development of fat in your body, it always stresses or pressures the pancreas. Whenever the diabetes is going to occur, or it can occur when the glucose levels are increased in your body, required insulin levels will not be produced because of the failure of beta cells due to pancreatic strain, which also leads to diabetes, and also again increases the cause and formation of the obesity. So does everyone with obesity will develop diabetes or diabetes? Definitely no. Not all individuals who are suffering with diabetes does not develop obesity, or neither who all are obese does not develop diabetes. So why usually it happens is there are certain parameters called as genetic factors which plays an important role. If the family history suggests a diabetes in their family, like father, mother is having, then the person who is having obese, they will easily develop the diabetes. And the other factor mainly is lack of physical activity. You should be getting up in the morning and start doing walking, running, jogging, anything, let it be whatever you like to do, that has to be done. And lifestyle changes, there are certain risk factors like alcohol consumption, or taking more stress. Less sleep also causes risk of developing diabetes in obese people very easily. So adequate sleep is always required. Always what we suggest is 7 to 8 hours of sleep is required. And definitely you should not take the strain, and you should not skip the breakfast or skip the meals. Food should be in proper timings. So these all, if you maintain by certain lifestyle changes, definitely if you are having obese, you will not develop diabetes. So balanced diet means like having food at regular intervals, what I had told, but optimizing your portions, like the carbohydrate levels, the protein levels, the fat levels, like how much you are eating, or like the time when you eat, like how much calories your consumption. All these things, if you manage to tackle all those things, definitely you won't get the diabetes even if you are obese also. So what basically I'm trying to say here is keep an eye on your food, whatever you eat. Try to avoid eating outside food like oily, masala, spicy food, or too cold food. Like you have to avoid basically like chocolates, cakes, sweets, ice creams, and then all other foods. So World Obesity Day, that is March 4th, we observe annually. So what I urge is keep regular physical activity and take out your stress, have adequate sleep, exercise 30 to 40 minutes per day. Usually on this day, a lot of healthcare professionals or a lot of government schemes will give you advertisements, will give you awareness, education materials in the newspaper or digitally or through social media. This all will be created on March 4th. It is basically observed to prevent the obesity in our coming generations.